and welcome to another edition of Wellbeing on Spectrum Television. Wellbeing is an interactive program designed to encourage a healthy living by bringing you up to date with the latest update on critical health issues. I am Mary Joseph. Please do well to follow us on all our social media platforms at Spectrum TV, or you can visit our website at spectrumtv.ng to be a part of the family. Today we address a pressing concern in Nigeria, and it is the resurgence of diphtheria. Join us as we explore the rising number of cases and its impact on states across the country. Diphtheria is a highly contagious bacterial infection that has made an alarming comeback in Nigeria, threatening the well-being of our communities. And to understand the severity of the situation, let's examine the data provided by the National Center for Disease Control, NCDC. According to the latest report from the NCDC, diphtheria cases in Nigeria have seen a concerning upsurge over the years, and Nigeria has previously reported diphtheria outbreaks, with the most significant reported in 2011 affecting the rural areas of Borno State in the northeast of the country. Since the beginning of 2023, nearly 800 cases of the disease have been confirmed in the country as of June 30th, with a total number of 80 deaths recorded and a case fatality ratio of 10%, affecting 8 states across the 33 local government areas in the country. The Nigeria's Health Authority have also confirmed an outbreak of the deadly diphtheria disease in the Capital Territory, Abuja, following the death of a 4-year-old patient. The Public Health Institute also noted that since December 2022, diphtheria cases have been in Kano, Lagos, Yobe, Katsina, Cross River State, Kaduna, Osun State, and the FCT, in which most of the patients are children aged between 2 and 14 years. Diphtheria is a highly contagious bacterial disease which affects the throat, nose, and can cause breathing difficulties. It can be spread from person to person through direct contact or air droplets, and it is fatal but preventable through routine childhood vaccines. But here in Nigeria, where low vaccination coverage is a public health challenge despite the availability of a safe and cost-effective vaccine in the country, that seems to be a problem. Joining me to discuss this is a health expert who has been closely monitoring the situation in Nigeria, and he would be shedding light on this particular issue. But before we dive into this conversation, let us quickly take this short break. We'll be right back.
Good health, they say, is something you can't buy. But the decision to live healthy is a choice that you have to make. Join health practitioners from diverse health fields as they provide you with vital information to help your day-to-day health decisions on Wellbeing, your wellness talk show. Wellbeing airs every Monday, 7 to 7:30 p.m. only on Spectrum TV.
You're welcome back to the show. It's still the program Wellbeing, your wellness talk show that is designed to keep you health conscious. Do remember to follow us on all our social media handles at Spectrum TV, or you can visit our website at spectrumtv.ng to be a part of the family. Today on the show, our focus is on diphtheria, and joining me to explore the rising number of cases and its impact on states across the country, please help me welcome Dr. Chidi Ferdinand, and he is the Secretary, National Association of Resident Doctors, Uyo Chapter, and is also the Business Committee and Publicity Secretary, ARD, University of Uyo Teaching Hospital. It's good to have you join me on the program, Dr. Chidi.
Thank you.
All right, so for the benefit of our viewers, could you provide a brief overview of what diphtheria is and how it's being transmitted?
It's okay. Thank you for that question. It's important to emphasize that diphtheria is a very contagious, highly contagious disease, like you highlighted. But the good news is that it's one of those vaccine-preventable diseases. Okay? But it can be spread from people to people, mainly by direct contact or inhalation of the droplets with somebody that, of course, has it. Over time, there's been certain changes we've noticed. Before now, it used to be said that it's a disease of children. But with the advent of vaccines that we'll discuss more later, it's now being seen as a disease of the aged. However, it can affect every age group. No age group is spared depending on immunity. It must be emphasized that diphtheria is a very highly potential fatal disease, as it could lead to acute respiratory failure, can lead to chronic heart failure, could even lead to death if not properly managed. And this part of the world where almost every condition is mistaken to be malaria. As we see later, bacteria presents with symptoms that look similar to that of typhoid malaria, especially hepatitis, has always been the problem before they realize the reason for malaria and the relationship of as today, we've recorded 567 confirmed cases with the last 3 that's about 18% in about 21 states. That's out of the 60 states of the country. So, of course, malaria is a public health concern as we speak.
So now, can you take us through what diphtheria is when we talk about identifying the symptoms and signs so that people could actually detect it?
Yes. It's important to state here that diphtheria is a bacterial infection. The associated causes in bacteria called Corynebacterium diphtheriae. The infection on its own called diphtheria can be either respiratory diphtheria, which is caused by Corynebacterium diphtheriae, or it can be a cutaneous diphtheria, which is caused by Corynebacterium or serums. However, the second one is not very uncommon. Okay, as compared to the first one, which is slowly becoming a health emergency. And like I had in the introduction, the diagnosis of diphtheria requires what we call high index of suspicion. The reason is because we have a lot of misdiagnosed cases where, like I said, we'll be treating for malaria because it shares similar symptoms of other medical conditions that are very common in our area. And so a lot of times we start treating for malaria and typhoid. Of course, from when the person is exposed to this hospital, it takes about 2 to 5 years as an incubation period. But of course, we have this infection, but they are not showing symptoms. So we don't need symptoms, but they are affecting people. They can be infectious for 4 to 6 weeks. They are showing symptoms, but they are affecting people. However, it is important to emphasize that when we start seeing certain symptoms like the patient is complaining of fever, but in this case, the pulse is very high, just really quick. You see, again, we rush to treat malaria typhoid. The fever that comes from malaria tends to be more easy. But for diphtheria, she just has this constant low-grade fever. Of course, there's this feeling we call it feeling of malaria. The person knows he or she is not feeling very well, but cannot really see. The person feels sick, let me get it that way. We feel sick, but you can't really see where the problem is actually coming from. Maybe just malaria and not okay. So you're worried what's going on, like just malaria, and you're there easily at the house medications that they are no longer working. Okay, there is a weakness and there is a headache. But you see, the very common one where 80 to 95% of patients will have sore throat. Okay, there will be sore throat. What is actually the only called diphtheria, where you must have heard of it before, is a patient presents with what we call headache, where due to cervical lymphadenopathy, the lymph nodes around the neck, because of infection, they become inflamed, and so the neck becomes bigger than normal. It's commoner in children. At that stage, the disease is already having complications. What I'm trying to say is that we must not wait until we see a classical movement representation before we can make the diagnosis of diphtheria. Because at that stage, of course, the patient can have one nasal history, they could change in the voice. Once the voice, the patient will not talk to the same voice to talk with, because, of course, around this vital region is where we have voice box and things to use talking. So when anything affects this area, how the patient could also have, they could also be counting. It has these myriad symptoms that are not just specific to the condition. So it makes the diagnosis difficult according to this diagnosis we are talking about.
Now, you said something about we should not wait. We shouldn't wait till the symptoms present itself. Now, diphtheria is a preventable disease, as everyone said. Yet we are witnessing a resurgence. It has happened before and it's back again. Why is it important for individuals to understand the significance of prevention? What are the potential complications or risks associated with diphtheria if this is not fully managed?
Yeah, like I said, it's sad in this part of the world our health behavior is very poor. Very poor health behavior. You so surprised like it's a vaccine thing that get it. And most times it's vaccine that but we are still going out from comfort zones to go get vaccine. See, the truth must be said, diphtheria as a disease condition has a tendency to affect every other organ, if not properly managed. Okay? It could lead to, like I said, it could lead to acute respiratory failure. As soon as the human mind stops breathing, your mouth is there. It could lead to cardiac failure. It could lead to neurological deficits where patients, the good thing about most of neurological deficits, as soon as the patient is recovered over time, the deficit disappears. It could even affect his life. It could affect the way we work. It can affect every part of the body. Ultimately, if not well managed within the next 5 years, it could lead to death. Like I said, we have this diagnosis. It is difficult most times to diagnose diphtheria except people are white. The reason is because the early people that we get are being misdiagnosed. It is when we die, and then those early deaths, in the case where we family members allow for autopsy, it is now discovered that it is diphtheria which is something, and then other people are affected, and then definitely most times we need to lose patients in this part of the world before the diagnosis of the is made. That should not be so.
Alright, so according to the NCDC, patients that were part of the suspected cases are children between the age of 2 and 14 years, most of the patients. Now, which age groups or population are more vulnerable to diphtheria? Because children are also there, but you also said it is something that has now advanced to an aged disease. How can we ensure that all of these persons receive popular preventive measures?
Yeah, thank you for that question. Like I initially highlighted, diphtheria was said to be a disease of children. Before the advent of the diphtheria, tetanus, pertussis vaccine that is given at 6 weeks of birth, it was said to be. Before that vaccine was given in 1920, diphtheria was said to be a disease of children. But you see, after the vaccine was invented, people started receiving it. Okay? It reduced the occurrence in children. But you see, we are going to discover, in fact, to be very truthful, the age group that are receiving are children under 12 and the elder greater than 40 years. Now, the reason that maybe it's pushing towards the elder greater than 40 years is because it has been found the vaccine don't confess immunity. The immunity wanes over time. So children that receive the vaccine, the diphtheria, tetanus, vaccine at 6 weeks old, if you check out immunization schedule, when a child is born, you're supposed to receive the vaccine at 6 weeks. You receive the second dose 4 weeks after the first dose. You receive the third dose 4 weeks after the second dose. You receive the booster at 3 months and booster 2 at 6 months. Now, eating that population of today, from the age of 12 and above, everybody is expected to receive at least one booster dose every 4 years. The reason is because it tends to wane, immunity tends to wane. The level of the antibodies are supposed to be in circulation to ensure you are protected from disease should be at least 0.1 international units a minute. So if the last time the patient collected this was at 3 years old, before the patient gets to the ages of 22, 24, 25, you should expect that as being that the patient is supposed to get the booster dose. But again, sadly, in our country we are still having children suffering from diphtheria. It tells you that a lot of those children were born in the church, in the house, and so they don't receive their vaccine at 6 weeks, 4 weeks later, 3 months, and 6 months. Because if they do, it will confess some degree of immunity. However, the vaccine confers about 80% of immunity. Because we've seen children who have received the vaccine still come down with the condition. But the difference is, if you have the vaccine and you come down with the condition, it is milder. The symptoms are milder as compared to somebody who doesn't or who are not getting the vaccine ever before. So these are the challenges. Lots of these children that have been born in church, homes, and all, and they will go to the hospital to get the vaccine. I think they are conquering this condition. Thank you.
So if you now check the states where we're recording the highest numbers of diphtheria cases, you would see that it's mostly in the northern region. Now, and this region are regions where we have limited healthcare access. Now, in this kind of regions, how can we ensure widespread vaccination and preventive measures for diphtheria?
Well, the function of the government is to secure the life and property of its citizens. And so, it's a particular to ensure, you see, everything that comes to the mountain should be to market. So even if it means the government sponsoring door-to-door vaccination of children under 12, it will go well. Why encouraging the adults who can make decisions to at least visit the healthcare center and get the booster dose with its every years. With this, can actually live free and eradicate this medical condition called diphtheria. It is actually
Okay. So, how does public health education and awareness contribute to promoting precautionary measures against diphtheria? Because, trust me, you said something about taking Muhammad to the mountain and that kind of analogy. But we need to do our own part. We need to play our own part. How can we encourage stakeholders to collaborate on enhancing understanding?
Well, talking about that, it is kudos should be given to stations like you are going to, because I'm sure as people listen to the program, they get knowledge that okay, there's a condition like this is prevented. How can it be very bad? Go get your vaccine. However, there's still also factors. You see, knowledge is hard. when you know the possible risk factors that can cause you to be prone or exposed to this medical condition, you're able to, on your own as an adult, work out modalities to see how you can also prevent it and prevent it around your loved ones and family. You see, it's been shown that people who have incomplete or have never immunized themselves for diphtheria are at very high risk to have a condition. So, regular sensitization and radio talk shows, TV programs fails to educate people about the condition as a way forward to making sure people will realize people not educated. In fact, even if it could be done in our local languages, so that those who can speak English can be aware of this and know that these vaccines are their primary health care centers is taken away from their houses so they can go take it. It will go about them. It's also important to know that, like I said, the vaccine over time infects wounds. So if you've gotten it before, once every 10 years, just go into a health center and have a job. That will take you for the next 10 years. It's also important to say that Nigerians should be encouraged to go out in their neighbors and get it. You know, when we go out to get our neighbors with vaccine, it confers what we call herd immunity. With herd immunity, the chances of infecting those that have not been immunized is reduced. It's also important to say that people who have recently traveled to states or countries where this condition is an epidemic or endemic, on return should be able to do one or two tests to be ensured they are not in the condition before they start affecting family members. Because, like I said, we have these symptomatic targets. People who have traveled to the other state, they are sick, they don't have it. They've contacted it, but they're not showing any signs and symptoms, but they're infecting loved ones and family members. Okay? It's also important to we can't emphasize the use of poverty and no socio-economic standards. Community, a lot of Nigerian population now, poverty is also a problem because it's also a factor. You see, it's real that there's a immune system, okay? Malnutrition, depression, and if you don't have people to feed well and feed your children, chances of malnutrition is there. And when there's malnutrition, the person is exposed to such risks. Of course, chronic medical conditions like diabetes, HIV, tuberculosis, all these are medical conditions that poses challenge to the immune system. And as soon as it's working on the immune system, of course, the chances of the patient having this. You see, whether we like it or not, the government should ensure like in our state, for instance, they should ensure that almost all the development and employment opportunities are not located in the city. Some should say the villages, because when everything is in the city, there's one we call the rural migration, and with that comes overcrowding. With overcrowding, of course, remember it's a respiratory infection when you cough out and the droplets everywhere where you're there. So with overcrowding, you're exposing people to this. Domestic pets, of course, have also been involved, but it's not involved with cutaneous type I spoke about. Smoking, alcoholism, all these have negative effects on the immune system. So exposing the person to the risk of coming down with diphtheria. There are so many, if any of all these things like this are being prevented, then we are preventing patients from coming down with the condition.
Now, that leads me to this particular question. You know, there are a lot of people who are hesitant to take up anything when it comes to vaccine. Anything, even if it's as free. But once it's getting into our body, we are quite hesitant as Nigerians or Africans to take such measures. Now, aside vaccination, what can you tell someone who is hesitant to take up these services? What can you say to them to actually take up these measures, to adopt it, to actually protect themselves and their communities from diphtheria?
Well, we may be hesitant like you say, but everybody wants to live. The management of diphtheria as a condition is centered on the prevention. If the preventive measures are taken and you get yourself vaccinated, there is no other option. There are no other options. You either take the preventive measures and don't take your vaccination number one preventive measures. Or very safe. Please, they are very safe. They are very safe. Let's also say that I know when we remember the incidents that happened with the COVID vaccine.
It's still lingering.
Yes, if you take that into consideration, knowing that the vaccine, the COVID vaccine was a delayed production. This condition just came up and a lot of things to rely vaccine produced as compared to a diphtheria vaccine that has been in existence since 1920. Since 1920, it's been part of our immunization schedule. Every child was born in the hospital and the mother came back after 6 weeks. In short, since 1920 to have gotten the vaccine, diphtheria, tetanus, pertussis. You see, there was a time when some with pertussis, what is called whooping cough in this country, but with the vaccine, it's slowly become like a it's a slow vaccine. This too can happen with diphtheria. The vaccine is free. And for adults, maybe you're not sure whether you have this give it to walk into the health center and take the booster dose once every 10 years. You are not just doing yourself before you're doing your family, your environment, and everybody you're doing the same thing. Because
you also mentioned something about poverty, because poverty plays a very huge role when we talk about medical care. How cost effective, how affordable are these vaccines?
For now, diphtheria vaccines are free.
Free?
They are free with healthcare facilities. You just go to and get yourself vaccinated. The only place you should worry is the transportation to the place. But of course, in our state, I'm proud to say that our healthcare facilities, for the primary healthcare facilities, the secondary healthcare facilities, the tertiary healthcare facilities, they are all functional. So, everywhere you are in our private state, you're just located in a primary healthcare center, and you're just less than 500 away from a general hospital. If you can't get to the when you have teaching hospitals, you can go to the primary healthcare center, you can go to a government hospital, a local government. Every local government in our private state has a general hospital. You can still go to one of those and get the vaccine for diphtheria vaccines for food.
Alright, so before I let you go, now let us just give this as a resounding reminder to everyone that is actually listening right now. What message would you like to convey to viewers about the significance of understanding and preventing diphtheria, especially addressing the hesitancy towards preventive measures? Because this is something we need to talk about, because this just came back. It was here before and it came back again, and it's quite alarming.
Yes, I want to say this, that diphtheria is an acute, subacute, preventable fatal disease. The emphasis is that it's preventable, but it's also very important to emphasize that it is fatal. The fact that it's preventable is enough to encourage us not to allow it to get to the fatal stage. We are blessed and lucky to have a condition that is a vaccine preventing disease. I want to encourage us as many that are here, to go to any place close to the healthcare facility close to you and get the vaccine. Whether you got it before, you never can tell whether it has been. Just don't get it to booster dose. Of course, I also want to encourage my friends in the healthcare facility to have a high index of completion as patients coming with complaints of the symptoms, because of course it is slowly becoming an epidemic.
Yeah.
As it is
right. We have a case like this.
We have a case as so it's not feedback that comes from facility today. Something that is actually should investigate more. If we can catch them, it will save a lot. Okay? Prevention is still the best way about it. You don't need to wait to be cured. Let's just go get vaccine to prevent fatality that comes with this condition.
Thank you so much, Dr. Chidi Ferdinand. Thank you so much, because you've actually thrown more light on this particular issue and have helped a lot of persons who are actually listening and are hesitant to take up these services. Thank you for joining this program.
It's been my pleasure.
All right, so Dr. Chidi Ferdinand is the Secretary, National Association of Resident Doctors, Uyo Chapter, and he is also the Business Committee and Publicity Secretary, ARD, University of Uyo Teaching Hospital, and we were talking about diphtheria as we try to throw more light on this particular issue that poses a grave threat to public health here in Nigeria. Thank you so much for being a part of the conversation. Do remember that you could also be a part of this conversation by joining the family. SpectrumTV.ng, be it on Facebook, Twitter, or also Instagram. You could be a part of this family by joining our website, and you could also try to stay informed and stay healthy. My name is Mary Joseph. Do enjoy the rest of the day's broadcast.